Psychotherapy may be short-term or long-term. The person who's coming for psychotherapy is somebody who is in distress.
Psychotherapy is about many different things. So for some people, psychotherapy is about gaining insight into themselves. They may not have a particular problem, they just want to gain insight into themselves. There'll be other people who have real difficulty in relationships, and there will be people who have very specific problems, could be developmental problems, could be addiction problems. It's quite a range of things, really. So when the question arises, when would be the best time to go to therapy? It really depends on what the person is bringing.
In terms of what people might expect, well, first of all, that they expect that somebody will be there for them, that the therapist will be very well trained, that they'll be accredited, that they adhere to an ethics code, and they look after themselves in terms of that. They look after themselves in terms of their own emotional life. They should expect the presence of the therapist, that the therapist is there for them. They should expect to be listened to. Now, that doesn't mean that sometimes in psychotherapy people aren't challenged, you know. I had a very good teacher who once said that sometimes we work for, with, and sometimes against somebody. The against somebody means not over against, but it really is about, it's struggling with someone because they also are just at the edge of something that wants to come to life, and that challenge is important. And it can be a very creative challenge. And really, they come to talk about what matters to them. Now, it's not just a chat. Somebody comes because they are experiencing emotional distress.
We tend to talk about clients rather than patients because, in fact, it's not a medical treatment. It's a talking, healing relationship between the professional therapist and clients.
So it's important, I think, in terms of psychotherapy that you give some time for someone to settle in and, to establish trust and, as they call it, a working alliance between yourself and the client.
The relationship is very important because it requires trust and it requires fairly deep exploration of personal problems. One of the things that people can do if they're looking at undertaking therapy is to arrange to meet a therapist and actually see how they get on, see whether what the therapist is offering is actually what the person feels they need.
The public can be confident that anyone who's on the ICP register is properly accredited.
All the therapists on the ICP register are all professionally trained, have met very high European-wide standards for psychotherapy, and therefore the ICP register is quite reliable.
It's almost like the ICP is like a brand, so that if you stand behind that brand, people can feel reassured that the people who are represented by the Irish Council for Psychotherapy adhere to very good standards and very good practice.
Therapists on the ICP register of psychotherapists work to best practice standards that apply across the European Union. And inherent in that is practicing in an ethical manner. And in the therapists who work with the ICP register, these therapists all adhere to pretty fundamental ethical principles. One, for instance, is that they work with very strong boundaries around confidentiality, would have a very strong sense of the client autonomy, and so they respect people's freedom to make their own decisions in life and to navigate their own way through life according to their own values and standards. And all therapists who are on the ICP register will make a commitment to work only within their competence. So they only work with issues and people that they feel competent to work with. And there's an ethical commitment to do no harm. So they are probably the most crucial of the ethical principles that therapists work under.